Tonight we want to have a look at hemophilia and COVID-19, how hemophilia patients are finding it difficult or even have been affected by COVID-19. Are they also being given these blood thinners to help their blood not to clot? Because we know when they do not have blood clots, then the dangers of having excessive bleeding in case of a cut. That is our conversation tonight, being helped by our guest tonight. We have James Kago, hemophilia patient, and also Irene Wakaba, who is a parent to a hemophilia child, and this condition will also be finding out why it majorly affects boys. Thank you so much, lady and gentlemen, for joining us tonight on the show. As always, beginning with the lady, maybe you can tell us what you do, and of course, who is hemophilic in your family?
Well, my name is Irene Wakaba. I am a teacher, a secondary school teacher. I a son who is 4 years old. He's hemophilia A severe with factor levels of 0.02, and he's 4 years old.
All right. Yes. And you'll be telling us more about hemophilia A severe, different types of it, and what it means by having hemophilia A severe. Thank you so much, Irene, once again for joining us tonight. James, please tell us what you do, and also you are a patient when you found out that you were hemophilic. What had happened?
My name is James Kago. I'm 38 years old. I'm a hemophilia A patient. I discovered, or it was discovered that I have hemophilia when I was just below 1 year old. I had a bleed when I was crawling, and I was taken to Kenyatta National Hospital, where I was diagnosed to have hemophilia A severe. Currently, I'm a HR practitioner, currently doing consultancies in HR. And hemophilia basically is a condition that I've lived with. I know it's an inherited condition that I have to live with for the rest of my life.
Mm-hmm. And you said that it's inherited, it's genetic. Maybe, James, staying with you, you can tell us, understand, when we talk about hemophilia, how does it happen? It's genetic. What exactly happens? Does it have anything to do with one of your parents maybe being hemophilic? Maybe you can tell us the science behind this condition. Hemophilia
is an X chromosome linked condition, whereby it's passed on to the sons by the mothers. It's mostly mothers tend to be carriers. However, in some instances, we've seen mothers passing on the condition to their daughters. However, in most cases, it's mother to the son, and it therefore affects more boys than it affects women. So 99% of the patients that have hemophilia tend to be boys because they have one X chromosome. So when it has the hemophilia gene, it means that it lacks the clotting proteins that are required to form a clot. So in most cases, you find boys with hemophilia will bleed longer than normal. And because of the three categories of hemophilia, that is severe, where it's below 1, sometimes you find it's below 10% bleeding clotting factor levels in the blood. It means that you can actually bleed spontaneously. You don't have to have been hit or have been cut for you to start a bleeding. In some cases, you have moderate patients who have between 10 to 50%. And these ones, sometimes you may have to have a little trauma for you to start bleeding. For the ones that have hemophilia, what we call the mild cases, these ones have a little more factor than around 50% or more. And therefore, for them, you must have a big trauma, like surgeries, for you to discover that they are actually hemophilic.
Okay.
Yes.
And Irene, when did you discover that your boy had hemophilia?
I discovered my boy has hemophilia at 8 months. He fell as he was playing. Remember, that is the time he's crawling. And he hit his forehead, and there was a swell. So when I took him to hospital, I decided to take him to Kenyatta. When I took him to hospital, they ran a test, and they said that he has hemophilia. Mm-hmm. And that is where our journey started at 8 months.
Did you know what hemophilia was? You know, at that time when your child was falling and they are bleeding, did you know what this condition was? Was there any other member of your family that had a similar condition?
Yes, I knew what is hemophilia because I had another son. who was hemophilic, but we had not known. At 3 years, he fell and he hit himself on the forehead, and unfortunately he bled to death. At the last point, like 1 week to his demise, is when the doctors knew he had hemophilia, but unfortunately he didn't make it. So I'd heard about the disease.
So, all right, sorry about that. By the time you realized that your son had hemophilia, maybe were there other instances where he was falling and bleeding, because this was at 3 years old, or did it find you as a shock that now the doctor is telling you that your child has died of hemophilia?
Okay, he used to fall and he had lumps, but I think out of ignorance that I didn't know, somehow he just healed naturally. But this one I think was serious, because he fell from a table up and fell down. I think the bleeding was too much. And the others used to heal naturally.
Okay.
Yes.
James, how about you, 38 years old? When did you realize, I know it's your parents who realized that you are hemophilic. Did you have the same experience, that you fell and you are bleeding and your parents took you to the hospital and they discovered it was hemophilia? Or how did you receive the news that you were different from other children?
When I was barely 1 year old, I used to play a lot. Actually, I would crawl a lot, and my knees would swell, and my elbows and my wrists. And when I was taken to Kenyatta National Hospital and the test was done and I was confirmed to have hemophilia, we started the prophylaxis program, where you are infused with whole blood, once in a while, so that you're able to give the body a bit of clotting factor. But that technology has now improved, and that's how I've been able to live all this long. Because then I remember when I was diagnosed to have hemophilia, I was told hemophilia patients do not live to be 18 years. But because of technology improving, we've been able to see improvement. We no longer get fresh frozen, we no longer get whole blood, but we moved to fresh frozen plasma, then to precipitate, and most recently, we now get what we call the factor 8 concentrates, which are, once you're infused, then the time taken to heal becomes shorter and you're able to live a near normal life.
Yeah. And how serious of a problem is hemophilia in the country in terms of statistics? Because it's genetic, or the numbers, do we have a large number of people with hemophilia, or it's a small community?
At the moment, we believe hemophilia affects 1 in every 10,000. That in a population. So that means in a population of around 50 million Kenyans, we believe we have around 5,000 patients who have hemophilia, and so far, as Kenya Hemophilia Association, the only organization that is tasked by the World Federation of Hemophilia to look after the welfare of hemophilia patients, we've only been able to discover 700 patients. That means over 3,000 or 4,300 patients are currently living with hemophilia, and they have not been diagnosed, and neither are they receiving treatment.
Okay, Irene, allow me to engage you, because at least for the first instance, you are able, for the second child, you are able to know my child could be hemophilic. But did you get did you have any kind of training that, you know what, maybe there's a possibility that my boys would have hemophilia, or was there any education that, you know, there are possibilities of having children who are hemophilic?
Yes, when I discovered this boy, now the second boy has hemophilia, I was introduced to the Kenya Hemophilia Association, which has a clinic there's a clinic at Kenyatta, and there I was educated on how to take care of the hemophilia child and what to expect. I was told that if I get boys, the chances are 50-50 that the boys may have hemophilia. And also, we have welfare meetings with the parents of these children who have hemophilia, where we go and talk about experiences on how to take care of the children, on how maybe to deal with different issues of when they have these bleeds. And so far, so good. At least, you know, a problem shared is half solved. We can share about hemophilia, and we are getting better. And also with the donation of factor that we are getting from the World Hemophilia Association, it is becoming better. Yes.
And what were your fears, especially with the second child, that now, because when they play, they hurt themselves, when they fall down, then it's going to be a problem. Did you have any difficulties into ensuring that your child led a normal life like other children?
Yes. Being a working mother, remember I have to go to work in the morning, come back late in the evening. Now, psychological fears were so many. Getting a caregiver who would understand my child and take care of my child when I'm away was one of the problems that I faced. And I thank God, eventually I got someone who would understand the child and take care of the child. Number two, I feared taking this child to school. He's now 4 years, and I introduced him to school just this term, this term that was closed, because all the time I was thinking taking him to school would be the worst experience that I would have. So I talked to so many people, I talked to the other parents, and they were really encouraging. And having other hemophilics, other children who have gone to school and hearing of their experiences, at least I came out of it. And also I have another boy who is older than this 4-year-old. The boy is 8 years old, and he's not hemophilic. So keeping the two of them together, remember boys like playing. Anytime I would see them together, I'll have a lot of fear, because I'll see that the other one, the one who is hemophilic, will get an accident. So I was really separating them. I wouldn't let them play together because of that fear that if they play together, this one will get an accident. But with time now, I'm getting used to it, and things are working better. Yes.
And James, you said that we could be having about 5,000 patients out here, and you are able to only discover 700. Now, the fact that when a child falls, then the bleeding will never stop, does this mean maybe there are people who've lost their lives, children who've lost their lives from this disorder, and it's undiagnosed? They do not know about it, and the cycle continues. What is the dangers of not having discovering the other patients out here?
I'll tell you for a fact that with the 5,000 patients that we anticipate we have in Kenya, only having discovered 700, we have done a lot of awareness campaigns across the country just to try and discover whether there are many other patients who are not receiving care and treatment accordingly. But one of the things that we've done, especially with the county governments, and through the help of one of our biggest donors, Novo Nordisk Hemophilia Foundation, they have helped us to establish treatment facilities across the country. So far, we have 7 treatment facilities where once we carry out the campaigns, the awareness campaigns, we encourage patients or potential patients who feel they may have bleeding disorders to go for testing, especially in those 7 facilities. One of those facilities is Kenyatta National Hospital. We have Moi Teaching and Referral Hospital, Voi Moi Teaching and Referral. We have Coast General Hospital, Moranga, Kisii, and now most recently we opened Bungoma in February, and we are anticipating to open one in Meru County. So we are hoping that we'll be able to reach out to these patients who have not been discovered. At one point we had a campaign in Bungoma County where we sat with traditional circumcisers, and they told us there are instances when they have circumcised traditionally boys who actually bled to death. And now when we did that sensitization, they came out and said, we now believe, or we think that family could actually have potential bleeders, and it would be good for them to come for testing. So those are the kind of campaigns that we're trying to do so that the communities can come out and we stop fearing to come out to seek services or treatment services. So we want to kill the stigma that hemophilia can actually be managed and you can live a near normal life even when you have hemophilia. And
Irene had mentioned that she was scared letting her boy go, and we know the nature of boys, they love to play. So is there a way that children with hemophilia can lead a normal life, or they have to stay at home? Because as a mother, I would also be scared to let my child go out and play, even to allow them to go to school, because I'm afraid they may fall and start bleeding and things may turn out actually not so good. So is there a way, James, that children with hemophilia can lead a normal life?
Yes. Children with hemophilia are actually normal children. Yeah. The only thing that they lack in their bodies is just the clotting factor. the challenge has been, because of the lack of awareness, even among parents, there's a lot of stigma. So even among the parents, you find there's a lot of fear that they don't want their children to pray, to go out and play. But what we encourage them is that let the boy go and play. The only thing that we do separately is that train the boy, talk to your son so that he can understand that whereas he may love football, he cannot engage in games that can actually cause trauma, like football, like rugby, but he can play other games that are more mild in terms of trauma causing, like swimming or cycling or just tennis. So we're encouraging them to adopt other sporting events that can actually be beneficial for them because of exercises, but also encouraging the parents should also train the other siblings and even the neighbors. How do you play with my son so that he doesn't get hurt in the process? Yeah.
And I'm going to ask you this question both, but I want to start with Irene. Irene, right now COVID-19 patients are being given something called thinners to ensure that their blood does not clot, because doctors are saying it's dangerous for COVID-19 patients. On the contrary, hemophilia patients require blood clots. Actually, they get the factors to help them with the clotting of the blood. So I would love to understand, as a parent, how is COVID-19 affecting you, and what are your fears, that as a parent, if let's say my child is affected with COVID-19 and they have to be given medication to prevent blood clot, which they need most, So what are your fears as a parent?
My main fears are, if this child is exposed and gets COVID, remember, this is a child who cannot take those thinners. And this is a child who can get a bleed even out of nowhere. They can get a bleed out of nowhere. So if they get COVID, I don't know how we are going to deal with it. So I try as much as possible to keep the child, to protect the child from COVID, to keep him indoors, to like maybe keep a mask on him all the time. And remember, he's a young child. So I keep on talking to him, the importance of that mask, the importance of staying indoors, because I can see that big challenge. If he's affected, he'll have a problem with using the thinners.
Yeah.
Yes.
James.
Yes.
Same question to you. How best should they be protected? Of course, first respond to the challenge being posed to hemophilia patients by the pandemic.
Yeah. Even before COVID, we normally discourage our patients from using aspirin-based, medications, because then they cause the thinning of blood. But with COVID now coming into the picture, what we've done is that as KHA, we have engaged the Ministry of Health. We've written to them and we've requested that if they can prioritize hemophilia patients to also receive vaccination, which then will put them at a lower risk of getting COVID-19. We are hoping that that will be approved. We are still engaging with them. We are hoping that we can get a positive feedback in the course of this coming week. And but for sure we are scared, especially because of if the result would be to use the thinners of blood, then it might be a bit scary for us as patients. So
do you have patients who've tested positive for COVID-19?
At the moment, no. We do not have any known case as yet. We are still trying to engage as many patients as possible just to understand whether there is any, but so far there is no clinically diagnosed patients to have COVID-19. But
you still have fears that if any case, then it would be a dangerous affair? Yes. The medication that are being prescribed for COVID-19 patients, the zinc, the vitamin D, can a hemophilia patient take that?
Yes.
Yes.
Hemophilia patients can actually take all the other medications. The only the ones that we normally discourage are the ones that cause the thinning of blood. However, even with the ones that are being prescribed, of course, we will. It would be good to once you have that prescription given, consult your hematologist wherever in whichever facility that is closest to you, so that they can actually guide you appropriately and you don't expose yourself to further damage.
Right.
Yeah.
Irene, let me welcome your closing remarks in terms of how best should the hemophilia patients be protected during this time that the pandemic is ravaging the world?
Well, maybe I would like to encourage my fellow parents let us not fear a lot. I know God is on our side. Let's protect our children. Let's keep them at home. And also, if they have to go somewhere, let them use the masks. And also, I wish the government would come in and maybe through the NHIF, buy for us factor. Because if I had that factor, if there was enough factor at KNH, I would be able to do home care if my child has a bleed. But now, if the child gets a bleed, I will have to take the child to Kenyatta, and that is exposing my child to COVID. I wish the government would do something on the hemophilics, at least in future plan, and buy us some factor so that we can add on what we get for donation from the World Hemophilia Association. Mm-hmm. Yes.
And James, as I welcome your closing remarks, maybe talk about what Irene has mentioned, the factors, the treatment for hemophilia. I know it's a disease that you only manage, but you require the factor, accessibility for the factor and the cost of it.
At the moment, personally, for me, I would use 2,500 international units of factor for a single injection if I have a bleed. That means, and one of that dose goes for around 50,000. So what that means is that the factor concentrates are way above the affordability of most Kenyans. So, and at the moment we are not getting it from the government because I would say hemophilia has been a neglected condition for a very long time. Luckily, there are strides that the Ministry of Health has made, and we are now working with the non-communicable disease department in the Ministry of Health, and we are still advocating to the Ministry of Health and through the government just to purchase for us a factor that the patients can actually use. That is our biggest challenge because, yes, we can go out and mobilize patients to come and seek services, but when they come out and they come to our clinics and they cannot find treatment or appropriate treatment for their condition, then it becomes a challenge on how to manage their condition. Number two, I would encourage our patients to come out and visit these centers that have been established in the various counties, to come out and seek services, especially to have diagnosis done. Because if you can identify that you have hemophilia at an early age, then we can be able to put you in a proper program early enough. For young boys, we are trying to put them in prophylaxis through the donated factor, so that they can live near normal lives. Mm-hmm. So again, as we also put these restrictions to manage COVID-19, I would request that we have some leeway of how hemophilia patients can be able to access their medication.
All right, thank you so much. Thank you, Irene. Thank you, James, for making time for us and, of course, having this conversation about hemophilia patients in the country and COVID-19. I hope the right people have heard this message. I'm Purity Museo. It's always great having your company right here on Family Matters Show. Do enjoy the rest of our programming. Good night and God bless.
Thank you.